Well, we begin this hour with British Columbia's crippling shortage of paramedics. For the second time in less than a month, a person has died while waiting for urgent care in the small town of Ashcroft. That's just west of Kamloops. CBC's Hilary Johnstone is following this story for us. Hilary, what are you learning?
Well, Hannah, we're learning that this 84-year-old man in Ashcroft died after waiting for an ambulance for more than 30 minutes. Now, at the time that the 911 call was placed, the volunteer firefighters did tell the caller that they were not trained to respond to a call like this. But the fire chief, who did have a bit of first aid training, did respond, tried to help the man. Unfortunately and sadly, those efforts were unsuccessful. But what we're hearing is that, this is a reminder of what people in small rural communities face if they cannot get access to immediate healthcare, immediate services when they need them. We've also heard from a local resident, a man who tried to step in and help that 84-year-old man who'd had the heart attack. Here's what he told us.
You could see that he's already turned color and everything, and I tried to help, but there was nothing I could have done for him. It makes me angry because we have an ambulance station right here, and what's the point of having an ambulance station right here if there's nobody there to tend it?
So in many cases, what is happening right now in some of these smaller communities is that these volunteer fire services are stepping in to try and fill the gaps because of a lack of ambulances, lack of paramedic, lack of healthcare staff in general. But in many cases, the people who volunteer at these fire halls do not always have medical training. They have their own full-time jobs. This is very much an on-the-side volunteer role. And what we're hearing from the mayor of Ashcroft is that these local communities sometimes feel forgotten. Here's what we heard from her.
Rural communities in this province have felt really neglected for the last 5 years or so. If it was Surrey Memorial Hospital that had its emergency department closed for an entire weekend, I think on Monday morning you would find people falling over themselves to find solutions and tell you how that was never ever going to happen again.
And the other thing, Hannah, that we heard from both the mayor of Ashcroft and then the mayor of other small communities in BC, such as Peachland, which is near Kelowna, BC, is that this also puts a huge mental and emotional strain on those volunteer firefighters because they know that they cannot provide the care that some of these people need when they respond to the scene. In some cases, some fire chiefs, volunteer fire chiefs, even say that they've had staff leave, not come back to volunteer because they know that there is this expectation that they go to more and more medical calls that they don't always feel prepared for.
And Hilary, what's the response from the province on this?
Well, we've heard from the province. They've offered condolences to the family of that 84-year-old man. We've also heard from the Ministry of Health that this is a priority, that they do recognize that, especially in smaller rural communities, that there is lack of staff, that this is a priority. We've also heard from the health minister on all of this. Here's what he said.
We're very concerned about that. But our job and our task is still what we're doing, which is to build out the ambulance service in rural BC, a permanent system that can continue and can be sustained over time.
And Hannah, finally, the other thing that we're hearing is that some of these volunteer fire services have actually decided to scale back the level of medical care that they can provide, not going to as many medical calls because after 2 years of the pandemic, an opioid crisis, and then, of course, the wildfire season as well, a lot of these smaller communities and their volunteer fire services say that they have other things that they need to prioritize as well. Even one more reason why we're hearing from some of those local mayors that they do feel that they need more resources pumped into those communities so that they can respond to those medical emergencies.
Okay, Hilary, thank you. Hilary Johnstone in Ottawa.